The condition of the feet, especially the feet, is an important indicator of human health. The feet are the foundation of the entire skeleton, on which the coordinated work of not only the musculoskeletal system, but also the internal organs, blood vessels, and nerves depends. Even in ancient times, people determined that the plantar surface contains many biologically active points, which are connected with all systems of the human body. In general, the feet should be closely monitored, because the slightest deviations in the body are reflected in the changes in the appearance of the feet. How to identify diseases based on the condition of the legs. The appearance of the feet can determine the presence of problems with certain organs and body systems, including the slightest abnormalities. Therefore, it is important to pay attention to the condition of the feet. This will allow you to see warning signs in time, begin treatment earlier, and avoid possible complications in the future. Cold feet. Cold feet are often an indication that blood is not circulating well through the blood vessels. This is a very common problem. It is often associated with a sedentary lifestyle. Even in a few hours, poor blood circulation can lead to blood clots, deterioration of the thyroid gland, Raynaud's disease caused by spasms in the blood vessels, and peripheral neuropathy. If the feet are constantly cold, this is a clear reason to see a doctor. In addition, a sign of poor blood circulation is the absence of fine hairs on the toes and skin of the feet. This may indicate that the blood does not reach the feet in sufficient quantity, and for the blood supply of hair follicles, it is simply not enough. If the feet are frozen all the time, it may be a sign of hypothyroidism, reduced activity of the thyroid gland. Most often this problem appears at a more mature age, about 40 years old. It also causes hair loss, chronic fatigue, unexplained weight gain, and depression. Stains are brown or red in color. Red or brown spots on the legs indicate serious liver problems. Often they begin to appear on the knees, calves, and then all over the body. They appear in a variety of sizes, from small rashes to small plaques. Red dots appear on the body due to the deterioration of blood vessels and circulatory disorders. It is in the lower parts of the legs that the primary signs of circulation problems first appear. The spots can be a symptom of liver failure, which lowers blood pressure and dilates blood vessels. Tingling and numbness. Tingling, numbness in the feet or toes, which increases at night, indicates a vitamin deficiency in the body, in particular vitamin B12 or folic acid. This symptom also occurs with high sugar levels and in some cases with diabetes. A aching pain in the legs and feet that prevents you from sleeping at night is often associated with a lack of iron in the body. In this case, it is necessary to take tests. Pain in the feet. A series of spinal nerves from the lower part of the spine, down the legs, and end in the feet. When the nerve roots, parts of the nerve coming out of the spine of these spinal nerves are irritated or compressed, pain in the foot can occur. Pain in the foot may also occur if a nerve is compressed near the hip, knee, or foot. Irritation or compression of nerve roots in the lumbar or sacral spine can cause pain from the lumbar spine and spread down the leg to the foot. Nerve roots can be compressed or irritated for a number of reasons, including lumbar disc herniation, internal disc leakage, lumbar osteochondrosis, and spinal misalignment. Vascular asterisks. Vascular asterisks, or meshes, are a group of dilated blood vessels that are very close to the surface of the skin. In appearance, they resemble a spider's web. Sometimes they have a red spot in the center. When liver problems develop, several spider veins appear on the legs at once, and sometimes it can be accompanied by the development of varicose veins. These vascular asterisks appear on the legs as a result of increased levels of estrogen affecting the blood vessels. The amount of estrogen can only increase in two cases: pregnancy or chronic liver disease. If this hormone becomes too much, it has a negative effect on the health of the vascular system. Some skin vessels, especially on the calves, increase in size up to 2 to 5 millimeters. Because of this, they become more pronounced and noticeable. In addition, vascular asterisks can be observed on other parts of the body, including the hands, back, and neck. A large number of these stars indicates liver disease, with a 95% probability. In most cases, this sign indicates fibrosis, cirrhosis, or alcoholic hepatitis. Cramps and spasms. Regular cramps can be caused by dehydration. Dehydration leads to muscles not getting enough oxygen, electrolytes, and nutrients, especially sodium, calcium, potassium, and magnesium. It can also be a side effect of taking diuretics, if such cramps occur while walking. This may indicate the presence of circulatory problems. In addition, cramps may be the result of overexertion or a lack of stretching during physical activity. Frequent cramping may indicate serious circulation problems or nerve damage. Bluish feet. The reason the feet are not bluish may be because they are not getting enough blood and oxygen. This symptom could mean a chronic problem with the blood supply, heart, or lungs. In the worst case, it could mean an impending heart attack. If bluish feet are not the only cause for concern, and occasionally there is also shortness of breath, chest pain, coughing up mucus, or fever, you should see a doctor immediately. Non-healing wounds. Long healing wounds are a telltale sign of diabetes. Elevated blood sugar levels can lead to nerve damage in the foot, so any scratch, abrasion, blister, or cut will not cause discomfort, but may well become inflamed. A wound that does not heal can also be a sign of serious skin problems. Unpleasant odor. There are sweat glands on the feet that often produce an unpleasant smell. If the feet constantly smell sour, it may indicate hyperhidrosis. To combat this problem, you need to wash your feet with soap and water, air them after washing, change socks more often, or wear special absorbent shoe insoles. Use baby powder to avoid blisters. Sometimes bad-smelling feet can be a sign of a fungal infection. Swollen feet. Swollen feet can indicate a wide range of problems, including dangerous ones. They can indicate poor circulation, heart, kidney, and liver failure, deep vein thrombosis, and lymphatic accumulation. Painless edema occurs when too much fluid accumulates in the body. Under the force of gravity, it escapes into the legs. If there is fever, redness, and inflammation in the legs, it could be a sign of infection. Decreased sensitivity of the feet. Diabetes mellitus develops diabetic foot syndrome, which primarily affects the blood vessels of the lower extremities and the peripheral nervous system, bone tissue, and joints of the feet. The first signs are decreased sensitivity of the extremities, impaired circulation in the arteries and small capillaries, foot deformity, dry skin, cracks appear, heel cracks. Heel cracks are linear breaks in the skin that occur as a result of loss of elasticity and the thickening of certain areas. In most cases, they are formed in the area of natural folds. When walking, the person often complains of painful and uncomfortable sensations, as well as burning and itching. Cracked skin over time can cause pain, cracks can bleed, and become infected. Diseases that provoke this symptom include dermatological ailments, fungal infections, varicose veins, diseases of the gastrointestinal tract, decompensated diabetes mellitus, hormonal disorder, vitamin and mineral deficiencies, helminthitis. In addition, the symptom may indicate diseases that lead to poor blood circulation in the lower extremities, yellowish or deformed toenails. Healthy nails should be pink and grow along the axis of the fingers. If the nails look sunken into the toes, however, it could be a sign of iron deficiency or even anemia. Yellowish nails growing away from the nail bed may indicate a fungal infection.